this. Getting close now. Baby capsule.
Thanks to Matt and Beck.
Thanks to Matt and Beck for lending us that. How many weeks we got?
7.
7 weeks. You right?
Yeah. Okay, I'll send you a message.
Love you. Bye. Bye. Morning. Just dropped Courtney off at work. Now I need to got myself a little feed. Got to eat that because I've got to take my little morning concoction of pills. And then I said in the last video I sort of had some more shocking news. Not necessarily all good, not necessarily all bad, but I'm just gonna smash my brekkie and my bunch of pills and then I'll update you on what's going on. Oh, just a bloody tablet. This is all the, I don't know if you can see it, crap I've got to take every morning. So, I had a pretty crazy response to my last video. I think it sort of didn't come across the way that I wanted it to. I was just sort of describing the, I don't know, the suckiness of the situation and how it felt. But I got a lot of messages of support and stuff from people that were kind of feeling for me a little bit. That's not really what I was going for. It was just sort of a tough period in transitioning between finding out this information that I know now, which is a bit of shocking news that I said I would update you on. And before I tell you what it is, I really want to, if it's something that you're going through, is the diagnosis process for whatever reason, if you're following this sort of journey that I'm going through, it's really important to really ask questions and go with your gut feeling and knowing that you really have the right specialist and the right oncologist. And I feel super lucky in a sense with sort of the oncologist that I've had, the specialist that I've had been dealing with, because if you remember some of my previous videos, and especially the last one, I sort of described that the treatment wasn't really working at all. So I'd had a follow-up PET scan and it showed that there was absolutely no impact on the disease whatsoever for the treatment I was going through. So the first step there was to go get another biopsy. So I got rushed in for another biopsy and they retested a new biopsy. They came back and said, yep, you definitely have classical Hodgkin's lymphoma. We're going to escalate the treatment to something else, but rather than escalating the treatment to what they usually would, which is the first treatment was on called ABVD, then they escalate that to what they call BCOP, which is basically like a cousin or a stronger version of the ABVD, and that's when they try and really attack the disease hard, but it's quite a bit more toxic. Instead of doing that and ramping up that treatment, my specialist decided to kind of take a step sideways, and now I know why, because he sort of went to a treatment which is like a second line treatment, which is what somebody would have if they had what they call a refractory disease, if it's a type of disease that doesn't respond to treatment, which is what they were worried about, or if I'd been treated, it had gone away and I'd relapsed in remission, so then I would come back and then do this treatment and then a stem cell transplant afterwards. So the news is that my specialist thought there was some really funny characteristics about what was going on with me and how I was responding to different treatments, because the good news is the new treatment that I started about 3 weeks ago, I'm about to start my second cycle now, but I started that first cycle and it seemed as if the disease responded straight away. I had all my lumps and swelling go down and all my lymph nodes, and then I went and got a CT scan for my lung, because remember I had a collapsed lung. I ended up in hospital for a few days, so I just wanted to double check on my lung and make sure everything was alright there and I wasn't developing an infection or pneumonia or something. And then when I went for the follow-up to see what my lung was like, the specialist was absolutely stoked because he said it looks like we've got close to a 30% reduction in all the disease you've got, which means what we've decided to go with is sort of working straight away. And that was before the cycle had even finished. So I've got the PET scan tomorrow to sort of follow up after the first round, because what's happening, they're doing a full cycle, then doing a PET scan, doing a full cycle, then doing a PET scan, because they want to make sure what they're doing is working. And it seems to be so far, so that's the good news. And the other part of the good news is my specialist, like I said, didn't take no for an answer. So he sent my biopsies off to 2 different hospitals in Australia. One of them's the Princess Alexandra, the PA hospital, and the Royal Brisbane Hospital. The Royal Brisbane Hospital has like a leading hematology team where they do special stem cell transplants there. I believe they're the only ones that do a particular type of stem cell transplant there in the whole of Australia. And both of them have all come back and said, yep, nothing's changed, you're still dealing with classical Hodgkin's lymphoma. And it didn't stop there. My specialist said, it's, you know, we've come back now. They went and retested my original biopsy, and all 3 hospitals, the Mater, the PA, the Royal Brisbane, all came back again with Hodgkin's lymphoma from the first test and the second test. But he kept digging and didn't take no for an answer. So what happened was he sent my biopsy off to QML pathology, to their leading hematology team, and particular one doctor, I think her name's Debbie Norris or Deborah Norris, and she's like a leading lymphoma expert in Australia. They sent my biopsies to her, and she has discovered that I actually have one of the rarest forms of Hodgkin's lymphoma you can get. So as of last week, I was re-diagnosed. I don't have classical Hodgkin's lymphoma. I have a nodular lymphocyte predominant Hodgkin's lymphoma with both T and B cell involvement, which means it's one of the rarest types of Hodgkin's lymphoma that you can have. Rare enough that I don't believe they said they had treated it in the cancer care center that I am in at the moment. But the plus side was, they said, even though it's a rarer disease, the sign that I'm responding to treatment is really good. So they added an autoimmune therapy as well called rituximab. A lot of people would know that drug if they've gone through some type of treatment. So it's sort of a mixture between treating Hodgkin's lymphoma and non-Hodgkin's lymphoma because of the characteristics of what I've got. Like I said, the downside is it's really rare. So the studies and the prognosis they have is quite poor. But it seems to be, in a lot of studies I've read that, and that my family have read as well, is that this never gets picked up, and they keep treating as if it's classical Hodgkin's lymphoma like they were doing with me, and then by the time they go through full course of treatment and nothing happens, it's kind of too late. So I feel super lucky in a way that my specialist has really dug into this and found some just odd things that were going on and how I was responding to certain treatments, and just kept digging into it. So what happens now is they've added another 2 rounds of the treatment I'm on, so it's called R-GDP. I was only meant to do 2 rounds, but now that they've sort of figured out it's a specific type, they really want to make sure they get rid of it. So they're doing 4 rounds of treatment, which unfortunately takes me to past our baby's due date, so I'm still going to be in treatment when the baby's being born. And then later in the year will be the stem cell transplant. So, like I was saying, the other part of the good news is, if it was classical Hodgkin's lymphoma and I wasn't responding to the treatment how it was sort of panning out, it's closer to what they call a refractory disease. Like I said before, it's when a disease doesn't really respond to treatment. It doesn't really matter what route you go down, it just sort of keeps coming back. So that's what the specialist sort of said. It's a positive sign that we found that it's something else, and that's why the treatment wasn't working, rather than it actually being classical Hodgkin's lymphoma and us changing all these treatments and they're not working. So far it seems to be working. Like I said, I've had a lot of swelling go down, still getting quite a bit of pain in my lung. Like I've had to take painkillers this morning for that, which sucks a bit, but I've had that checked out a couple of times on the CT scan, and they said it's just sort of inflammation in the lining of my lung. And tomorrow's a PET scan, so hopefully we get some really good images on that PET scan, because it's, you know, it's already obviously on a CT scan reduced, and then it feels like physically it's also reduced. So once we have that PET scan. I've got the images of the old scan of what the disease looked like, and then we'll get some new images tomorrow, and hopefully they'll look a lot better, and I'll sort of compare the two and maybe chuck them up on the video. I've also got another video which I was going to put out, which just shows you the amount of medication that I have to take and what it's for while you're going through this treatment. So that's the news. I've been re-diagnosed nodular lymphocyte predominant Hodgkin's lymphoma, not classical Hodgkin's lymphoma. Like I said, bad news that it's rare because I haven't really treated it much. Good news, it seems like the treatment's working a bit, and the other good news is it's not a refractory classical Hodgkin's lymphoma. So once again, I always appreciate the support that I get, especially in the last video. I must have seemed like I looked really sad or something, because a lot of people sent me a lot of messages, which I really appreciate. I really appreciate the encouraging sort of words of support. But I'm okay. But yeah, it's just it's kind of hard to get across what it feels like sometimes without it sort of being a bit of a Debbie Downer kind of situation, because it does suck. Like, the whole thing sucks, but at the same time, like days like today, I feel fine. So you know, it's amazing what the body goes through, and then it's like you almost forget what it feels like when you have the good week between treatments. But you know, it's all going to start over again Thursday this week, but like I said, scan tomorrow, and I'll keep you guys updated on that. And thank you again always for liking, watching, subscribing, positive comments and support. So take that information as you will. I don't know how many people have had this type of lymphoma that I have, but you know, there's good and bad prognoses with it both. But like I said, I think we're pretty lucky that we've got the specialist that we had, because he really took the time to dig deep and really find out what was going on, and found something that a lot of places probably wouldn't find, and it's ultimately probably saved my life. So thankful for that, and I'll talk to you guys soon.